Today I'm going to share some important information about the risk factors and complications that can be associated with peripheral neuropathy. First, let's go over the risk factors. Diabetes is a huge risk factor, especially if your sugar levels are not under control. Alcohol abuse can also increase the risk, as can vitamin deficiencies, especially vitamin B. If you've had infections like Lyme disease, shingles, Epstein-Barr virus, hepatitis C, or HIV, you could also be predisposed to peripheral neuropathy. Autoimmune diseases like rheumatoid arthritis and lupus increase the risk as well. Kidney, liver, and thyroid diseases are also risk factors, another reason why alcohol abuse should be avoided. Chemotherapy is another. You may have heard of people who've gotten peripheral neuropathy after a chemotherapy treatment, or a series of them. But it's not just chemotherapy for cancer that can be a problem. Exposure to any type of toxin is going to affect the body and damage the nerves. Repetitive motion activities can also be a risk factor. A family history of neuropathy can cause a problem as well. If you have a peripheral neuropathy, you should also be aware of some serious complications. For example, you are more predisposed to burns and skin trauma because you can't feel temperature changes appropriately. You don't know what's happening. We've heard stories from patients who burn their feet as they're trying to warm them by the fire. They didn't know their foot was burning because they couldn't feel it. Infection is also a common complication. The feet and hands won't heal as quickly because of the reduced blood flow to the area, which means the wound is open for a longer period of time and more susceptible to infection. Infection can also happen because you stepped on a nail or a thumbtack without knowing it. The tack could stay in there for a day before you know you're bleeding. If you have areas of numbness, you always want to check to make sure there are no injuries, especially if you have diabetes, which also slows the healing process. Other major complications include problems with balance. If you can't feel your feet and you have some muscle weakness, your chances of falling are definitely increased. Peripheral neuropathy can be dangerous. There can be a lot of complications. So if you have any of the symptoms of neuropathy, it's vital to get checked out as soon as possible. Get a proper diagnosis and get the right type of treatment, something that actually fixes the cause of the problem instead of just covering up the symptoms. That's what we do here at Renew Health. We try to address the cause of the problems instead of just mask the symptoms of the problems. If you feel like you have peripheral neuropathy and want to know if one of our regenerative treatments can help you, give us a call today at Renew Health. We'd love to see you. Thanks.